Human papillomaviruses, also called HPVs, make up a group of over 100 related viruses that infect people. Most HPVs can cause common skin warts, usually on the hands or feet. However, about 40 types of HPV infect the genitals, which are the sex organs on the outside of the body. These HPVs cause the most common sexually transmitted infections, illnesses transmitted from one person to another through sexual activity. Some genital HPVs are low risk and may only cause warts on and around the genitals and anus of both women and men. Rarely, these HPVs can also cause warts inside the mouth and throat. Other genital HPVs are high risk. They can lead to cancer of the lower end of a woman's uterus, called the cervix. Less commonly, these HPVs can lead to other genital, anal, or oral cancers in both women and men. It's important to know that most HPV infections cause no symptoms, and the low-risk genital HPVs that cause warts are not an important cause of cancer. People infected with either a high-risk or a low-risk genital HPV spread it through skin-to-skin contact during vaginal, anal, or oral sex. For infection to occur, HPV enters through tiny cuts in the skin around or inside the penis, vagina, throat, or anus. The virus makes its way down to the cells in the bottom or basal layer of skin and infects them. As the infected cells divide, the virus begins to make copies of itself. Eventually, the infected cells move up through the skin layers, releasing new viruses that can spread the infection to other cells. For most people, the cells of the immune system can destroy the infected cells, along with the virus, within 2 years. But in some people, the immune system isn't able to destroy all of the viruses, leading to an infection that doesn't go away. HPV-infected cells may multiply over several weeks or months. If the cells are infected with low-risk HPV, they begin to form warts around the genitals. If the HPV is high risk, it may damage the cell's genetic material, causing the cells to become precancerous. Over a period of years, a cancerous tumor may slowly form as the damaged cells continue to multiply. The most common cancer from high-risk genital HPV is cervical cancer. There is no cure for any type of HPV infection. However, the Gardasil vaccine can help protect against 2 of the most common high-risk HPVs that cause genital cancers. The vaccine also helps protect against 2 of the most common low-risk HPVs that cause genital warts. For best protection, preteen girls and boys should receive 3 doses of the vaccine over a period of 6 months before any sexual activity takes place. The vaccine injects dead proteins from HPV viruses into the bloodstream. These proteins don't cause infection. But the proteins do stimulate certain immune cells to create markers called antibodies that can identify these HPVs. Later, if the live versions of these viruses invade the skin, the antibodies recognize and attach to them. These immune cells destroy the marked viruses, which prevents an infection from happening. It is important to note that the vaccine does not protect against other types of HPV not included in the vaccine. The vaccine also doesn't reliably treat cells that are already infected. High-risk genital HPVs that cause cervical cancer are most treatable when diagnosed early. Women should have a Pap test to see if their cervix has abnormal or precancerous cells, even if they've had an HPV vaccine. Check with a healthcare provider to find out how often to get this test. During this procedure, a healthcare provider will collect a small sample of cells from the cervix. These cells will be examined under a microscope to see if they're abnormal or cancerous. A separate HPV test will look for genetic material from high-risk types of HPV. When a Pap test and HPV test are done together, it's called co-testing. If these tests show abnormal cells, a healthcare provider will recommend specific treatment based on the woman's age, medical history, and the abnormality of her cells. While there is no cure for an HPV infection, both abnormal and cancerous cells can be treated. Some types of HPV can cause common skin warts or genital warts. The warts may go away without treatment as the immune system fights off the HPV infection. If the warts are painful or don't go away, visit a healthcare provider so they can examine the warts to determine the best way to remove them. Although you can treat common warts at home, do not treat genital warts yourself. Procedures to remove either common warts or genital warts include freezing with cryotherapy, burning with an electric current called electrocautery, or by surgical removal. For more information, talk to a healthcare professional.
Cervical cancer is one of the most preventable types of cancer with regular testing and is highly curable when found early. You can take action to avoid exposure to HPV or human papillomavirus, the most common cause of cervical cancer, by limiting the number of people you have sex with, avoiding sex partners who engage in high-risk activities, delaying sex until you're older, and using condoms to help prevent the spread of HPV and other sexually transmitted diseases. Avoid smoking, which increases the risk of cervical cancer in women infected with HPV. Get vaccinated with Gardasil, which prevents infection with the two types of HPV responsible for most cases of cervical cancer. Get annual Pap tests, which look for precancerous changes on the cervix that might develop into cervical cancer if not treated in time. Get the HPV test, which tests for HPV in the cervix. Be sure and talk to your doctor about ways to reduce your risk of cervical cancer. Early cervical cancer typically does not cause symptoms, but it can be detected early during annual checkups. As the cancer grows, you may experience symptoms, such as vaginal bleeding when you're not having your period, or after menopause, unusual vaginal discharge, pelvic pain, or bleeding or pain during sexual intercourse. Other health problems may cause these symptoms. You should see your doctor if you have any symptoms you're concerned about. The staging of cervical cancer refers to the extent of the disease. Doctors stage the disease according to the size of the tumor and whether it has spread to nearby tissues or other organs of the body. Stage 0 is not considered invasive because the cancer cells are found only in the top layer of cells of the cervix. Stage 1A is considered invasive cancer because the microscopic tumor grows through the top layer of cells into the underlying cervical tissue and is 3 to 5 millimeters deep by 7 millimeters wide. Stage 1B cervical cancer has two scenarios. One, where the tumor still can only be seen with a microscope, but is larger than 5 millimeters deep and 7 millimeters wide. In the second scenario for stage 1B, the cancer can be seen without a microscope and is larger than 4 centimeters in diameter. In stage 2A, the tumor spreads beyond the cervix to the upper 2/3 of the vagina, but not to the tissues around the uterus. In stage 2B, the cancer spreads to the tissues around the uterus. In stage 3A, the tumor spreads to the lower third of the vagina. In stage 3B, the cancer spreads to the pelvic wall, the lining of the body wall cavity between the hips, or it may spread to the ureters, tubes that carry urine away from the kidneys to the bladder. If the flow of urine is blocked, the kidneys can become enlarged or stop working. In stage 4A, the tumor invades nearby pelvic organs, such as the bladder or rectum, and may spread to the pelvic lymph nodes. In stage 4B, the cancer spreads past the pelvic lymph nodes to other places in the body, such as the liver, intestines, or lungs. Treatment options for cancer include surgery, radiation therapy, and chemotherapy. You may receive one or a combination of these treatments, depending on the size of tumor, whether it has spread, and whether or not you would like to be able to have children. You have several surgical options, depending on the type and stage of the cancer. During early stage 1A, your surgeon may perform conization to remove a cone-shaped piece of the cervix. One example of conization, called LEEP, or loop electrosurgical excision procedure, uses a thin wire heated by electricity to remove the tissue. During later stage 1A and 1B, your surgeon may perform a radical trachelectomy to preserve your uterus if you want to be able to have children later. The surgeon removes the cervix and upper part of the vagina and places a stitch at the lower end of the uterus to act as an artificial internal opening of the cervix. During early stage 1A, your surgeon may perform a total hysterectomy, removing the uterus and cervix. During later stage 1A and 1B, your surgeon may perform a radical hysterectomy, removing the cervix, the tissue around the cervix, the uterus, and part of the vagina. During either a total or radical hysterectomy, your surgeon may remove other tissues, such as the fallopian tubes, ovaries, or lymph nodes as necessary. If the cancer recurs, your surgeon may perform pelvic exenteration, removing all the organs and tissues as in a radical hysterectomy, plus the pelvic lymph nodes, bladder, vagina, rectum, and colon, depending on where cancer has spread. Radiation therapy, or radiotherapy, uses high-energy rays to kill cancer cells in the treated area only. External beam radiation therapy is directed at the cancer's location from a machine outside your body. Brachytherapy, or internal radiation therapy, is directed at the cancer's location from a device placed inside your body. Chemotherapy, a systemic treatment, uses drugs to stop the growth of the cancer cells by either killing them or inhibiting their cell division. Once the drugs enter the bloodstream, they can travel and reach cancer cells throughout the body.